Welcome to Sabra Says. I'm Dr. Madsen, licensed clinical psychologist with over 30 years of experience bringing psychology insights to you. Today, we're going to talk a little bit about what to expect on your first day of therapy. So, when you registered for session, if you have already or if you plan to, um, they will have you fill out a variety of forms. Sometimes therapists during the first session will go over these forms with you, sometimes not. But most importantly, I think, is the form that you fill out related to HIPAA and confidentiality rights and privacy rights. So, um, it's one of the biggest barriers to treatment, I think, is that people are fearful that if they go to therapy, their information will be compromised somehow or used against them in some way. I've heard on a number of occasions people will say, "Oh, I'm afraid," like say if they're having suicidal thoughts, that if I tell the therapist what I'm really thinking, they're going to lock me up. And in reality, nothing is further from the truth. I don't know any therapist or psychologist that wants to lock people up. That's not fun. It's often not helpful, and we avoid it at all costs. But if there is a legitimate safety concern, sometimes, we are put in a position where we have no choice. So, limits to confidentiality include if you are a danger to yourself. And we have a complex way of assessing that. Simply having thoughts about harming yourself is not grounds for an involuntary commitment. Um, in fact, people often have suicidal thoughts, either um, passive thoughts, like kind of, why am I here? What's the point kind of thoughts, or more active thoughts where people have a plan and intent. They have a means, and they actually maybe even have tried in the past. So there's a lot of things that we assess for, but no matter what the situation is, if the person can commit to safety, and can agree to certain stipulations for to ensure that safety, then we will not involuntarily commit somebody. We will work with that person to try and establish safety rather than do that. So that is one situation where, if somebody really is a danger, yes, we will have to call, crisis intervention or the hospital or sometimes even the police to make sure that the person is safe. The second instance would be duty to warn. If somebody comes to therapy and they say they're going to hurt somebody else or kill somebody, we do have a duty to warn. Um, so, just having thoughts about things that can be evaluated. But if somebody is like, sincerely a risk to harm somebody, then we have the right to break confidentiality in those instances to make sure that people are safe. The third instance of, limits and confidentiality has to do with children and the elderly and abuse. So, if somebody comes to session and we feel that that person is abusing a child, um, and that's also a complex evaluation. It's not just, I lost my temper and I spanked my child. It's not just that. We're talking about legitimate abuse here. Um, and that goes for the elderly as well. Then, we do have a duty to, we are mandated reporters, for children and the elderly. Other than those three situations, pretty much what you say in therapy is confidential unless you sign a release of information. And that is a form that you sign, and it says who you're releasing the information to. Like, say, for instance, you wanted your family doctor to have information about your treatment. You would have to sign a paper, saying that. Without a release of information, we cannot provide information to anybody. So even if somebody were to call and say, "Hey, is so and so in treatment there?" We cannot even acknowledge that you're in treatment unless we have a release of information. And we take that very seriously. It takes us many, many years of education and work experience to obtain licensure, and we don't want to lose it over something like that. So, we do take it very seriously. And obviously, we're in the field to help people. Like, we don't want to harm people in any way. That is the opposite of what we want. So, that's just a little brief on the paperwork and limits of confidentiality. Otherwise, in your first session, it's getting to know your therapist. It's about the relationship. We are human beings and we have different personalities just like everybody else. And sometimes it's a fit and sometimes it isn't, no matter how skilled we are. So somebody may come to therapy and I may have the correct specialization. But when we meet, for whatever reason, we just don't mesh. It's okay. You know, um, Sometimes people choose to go see somebody else. Sometimes people will interview therapists where they'll set up an initial evaluation with a number of therapists to try and figure out who they have the best fit with, and that is okay also. So, the first session, there's relationship building, building a rapport, a trust between the two of you, making sure that you're both on the same page as far as your goals. Um, I'm often honestly surprised at how often people come to me for therapy and I say, "What are your past experiences in therapy? Like, what were your goals?" And they just kind of look at me blankly and say, "I was never, um, nobody ever even talked about goals before." And that is something that really should happen. If your therapist doesn't bring it up, you should bring it up, because they are doing a treatment plan and they are writing down goals. They just may not be communicating those goals with you. And personally, I think it's important for the patient to be aware of what their goals are and really participate because you're the client, like you should be getting what you need out of therapy. And how do we know what you really need unless you express that to us? So, you talk about like, why are you here? What brings you to therapy? What are your goals? Then we do an initial evaluation, and that involves getting a very detailed history about your current presentation, your psychological history, your medical history, your substance abuse history, um, your medications, your developmental history, social history, occupational and academic history, legal history. About covers pretty much covers everything. Um, and that takes time. Sometimes that takes more than one session, and people don't realize that. Like sometimes they come to therapy and they think they're going to make tons of progress right away. And honestly, just be prepared that the first session is a getting to know you and getting history session, and kind of laying the groundwork for the next sessions where you begin really working together. Um, and it takes time. So I would encourage all of you, if you are considering starting therapy, to just go into it with the understanding of um, that this isn't like you go once or twice and everything is fixed. Therapy takes time, and depending on your history and how complex it is, it may take a long time. For people with chronic conditions that don't have a lot of support outside of the therapeutic relationship, some people may be in therapy their whole life, and that's okay if they need that support. But everybody's different, depending on their situation. But I can tell you, it takes at least, I would say, 6 sessions, no matter what is going on, to adequately address an issue, even if it's just an adjustment issue. So, just be kind of mentally prepared for that. Um, and be patient. Be patient with yourself. Be patient with your therapist. Sometimes people will say, well, my therapist said something that really bothered me, and so I'm not going back. And, you know, in real life, we don't do that. In real life, well, hopefully, in real life, we would go to the person and say, you know what, I'm not sure what you meant by that. Let's clarify, like, what did you mean by that? And work through it with your therapist, because we're not mind readers. That's the other thing, is people think like we're psychic or something, like we can read minds. We cannot read minds. We're intuitive people. We pick up on body language. We pick up on a lot of things, but we're not psychic. So if you don't tell us what's happening and what you're thinking, we don't know. People lie in therapy. They do. And that's fine. If that's where they're at, it's not helpful to the therapeutic process because you're not going to make a whole lot of progress if you're dishonest in therapy. But that's up to the patient. We're not lie detectors either. So just understand that it takes time. You need to be honest. You need to communicate with your therapist and, just try and be patient with the process. But um, almost everybody that's worked with me says that it is a life changing um, thing to really commit to therapy and invest in your own personal growth. So I hope that this video is helpful in preparing you for your first session if you decide to begin therapy anywhere, and that this way you're feeling a little bit more prepared, maybe a little bit more confident going into that first day. Thank you for watching. If anybody has questions or comments, please feel free to comment online. And I do try to respond to people's questions as long as they're appropriate. I cannot give personal advice as a psychologist to people on social media, as you know, because of limits of confidentiality, and also that, the you're not my patient, basically. So I can give general information about psychology that is helpful, but not personal advice as a psychologist. So just be aware of that if you do make a comment. All right. So everybody have a great day. And my next video will be on what is cognitive behavioral therapy if you're interested. Take care.